The mortar shell exploded 30 meters from the makeshift aid station, sending a shower of concrete and twisted metal through the air. Staff Sergeant Maria Santos didn't flinch as debris peppered the canvas walls around her. Her hands remained steady as she compressed the spurting femoral artery of Private Jackson, whose leg had been nearly severed by shrapnel 15 minutes earlier. "Medic! We need a medic!" The desperate cry came from somewhere beyond the smoke and chaos, but Maria couldn't leave Jackson. Not when his pulse was already thready and his skin turning the pale gray that meant shock was setting in fast. Preparing and narrating this type of story took us long efforts and hard work. So if you are enjoying the story, please consider subscribing to our channel. Santos. Captain Rodriguez's voice cut through the din of battle. "Leave him. We've got multiple casualties incoming." Maria's jaw tightened. "Leave him." As if Jackson was just another piece of equipment to be abandoned when things got tough. She'd heard those words before, too many times. Just a medic. Just patch them up and move on. Don't get attached. But Maria Santos had never been just anything. Another explosion, closer this time. The ground shook beneath the folding table that served as their operating surface, and Jackson's eyes fluttered open, unfocused and filled with pain. "Am I gonna die?" he whispered, his voice small and scared. 19 years old, Maria knew from his file. Same age she'd been when she'd first enlisted, back when she'd believed that being a medic meant staying safely behind the lines. "Not today," Maria said firmly, her voice carrying the kind of authority that came from 5 years of proving herself over and over again. She glanced at the chaos around them. Her surgical kit lay open beside Jackson's stretcher, instruments gleaming despite the dust and smoke. The same instruments her colleagues had mocked her for carrying. "Real doctors use those in real hospitals," Sergeant Williams had sneered. "We're just field medics, Santos. Stop pretending to be something you're not." The irony wasn't lost on her now. Jackson's blood pressure was dropping. She could see it in the way his lips were turning blue, the way his breathing had become shallow and rapid. He needed surgery, not just field dressing, real surgery. The kind they said medics weren't qualified to perform. Maria looked toward the entrance of the aid station, where smoke billowed in from the street beyond. The nearest field hospital was 40 minutes away by convoy, assuming they could even get a convoy through the active combat zone. The nearest surgeon was Dr. Patricia Chun, currently pinned down in a building 2 blocks away, according to the radio chatter crackling from Captain Rodriguez's comm unit. Jackson had maybe 10 minutes before the blood loss became irreversible. "Rodriguez!" Maria called out, not taking her eyes off her patient. "I need you to help me move Jackson to the surgical area." "What surgical area? Santos, we do now." Maria's voice carried a tone that made the captain stop mid-sentence. She was already moving, wheeling the stretcher toward the back corner of the aid station where the lighting was best. "And I need someone to maintain pressure on this wound while I scrub in." "Scrub in?" Rodriguez stared at her like she'd lost her mind. "Santos, you're a medic, not a surgeon. We need to get him to the field hospital." The field hospital might as well be on the moon right now. Maria was already pulling on sterile gloves, her movements quick and efficient. "He'll bleed out before we get him there. You can't just—" "Captain." Maria turned to face him fully, and Rodriguez saw something in her eyes that made him take a step back. It was the look of someone who had made a decision and would not be swayed. "Jackson is going to die if someone doesn't operate on him. The next few minutes, I'm someone, and I'm here." Before we dive deeper into this incredible story, I want to take a moment to thank you for watching. Creating and narrating these detailed, novel-length stories takes tremendous time and research to bring you the most engaging content possible. We're embarking on a journey of nearly 50,000 words together. That's a full novella. If you're already hooked by what you've heard, please show your support by hitting that like button, sharing this story with someone who would enjoy it, and subscribing to the channel. Don't forget to ring the notification bell so you never miss our latest stories. This is going to be an epic adventure, so get comfortable. And let's continue with this remarkable tale. Maria Santos had learned long ago that respect wasn't given, it was earned one life at a time. But even after 5 years in the Army, 3 deployments and more casualties saved than she could count, her fellow soldiers still introduced her the same way. "This is Santos. She's just a medic, just a medic." The phrase had followed her from basic training at Fort Sam Houston, where drill sergeants had made it clear that medics were support personnel, not real soldiers. It had echoed through her advanced training at Fort Leonard Wood, where male trainees questioned whether a woman could carry a full pack and a wounded soldier simultaneously. And it had haunted her through 2 previous deployments, where infantry officers treated her like a glorified first aid kit useful in emergencies, but hardly essential to mission success. But Maria had always known she was more than that. She'd known it since she was 12 years old, growing up in East Los Angeles, when her grandmother had suffered a stroke during dinner. While her parents panicked and her siblings cried, Maria had calmly called 911, checked her grandmother's pulse, and kept her airway clear until paramedics arrived. The MT who took over had looked at her with something approaching respect. "You did good, kid," he'd said. "Real good." Ever think about becoming a paramedic? Maria had thought about it. She'd thought about medical school too, but her family's financial situation made that dream seem as distant as the stars. The Army had offered a different path: medical training, college money, and the chance to serve something bigger than herself. What it hadn't offered was the respect she'd hoped to find. That respect she'd learned had to be taken now, as she prepared to perform what could be the most important surgery of her career in the middle of a war zone. Maria reflected on the long road that had brought her to this moment. Every doubt, every dismissive comment, every time she'd been overlooked for promotion or excluded from mission, planning all of it had led to this single moment, when her skills would mean the difference between life and death. The aid station they'd established in the abandoned school building had been intended as a temporary casualty collection point. Nothing more. The real medical work was supposed to happen at the field hospital, where real doctors with real operating rooms could handle serious cases. But the field hospital was 40 minutes away, and Jackson didn't have 40 minutes. "Talk to me about what you need," Captain Rodriguez said, moving to stand beside the stretcher. His skepticism was evident, but he was a good officer who trusted his people to know their jobs, even when those jobs seemed to extend beyond their official duties. "I need Corporal Martinez to maintain steady pressure on the wound site," Maria said, her voice taking on the clinical tone she used when stress levels peaked. "Not too much, just enough to slow the bleeding without cutting off circulation entirely. Thompson, I need you to monitor his vitals every 30 seconds and call out any significant changes. Peterson, you're going to assist me directly. That means you do exactly what I say, when I say it, without question." Private Peterson, barely 21 and on his first deployment, looked terrified. "Sergeant, I don't know anything about surgery." "You don't need to. You just need to follow orders." Maria was already laying out her instruments with practice precision: scalpel, hemostats, suture materials, gauze. The same tools she'd carried in her personal kit for 3 years, over the objections of multiple superiors who'd told her she was overstepping her bounds. "Where did you learn to do this?" Rodriguez asked, watching her work with growing fascination. "Everywhere," Maria replied, not looking up from her preparations. "Army medical training covers basic surgical procedures. Most medics just never get the chance to use them. I've also taken every advanced course the Army offers: battlefield surgery, trauma response, emergency procedures, plus some civilian courses during leave time." What she didn't mention was the hours she'd spent studying surgical texts in her spare time, watching YouTube videos of procedures, practicing sutures on pigs' feet she'd bought at the grocery store. Her bunkmates had thought she was crazy, spending her free time preparing for situations that would never arise. They'd been wrong about that too. Jackson's breathing was becoming more labored, and his skin had taken on a waxy quality that Maria recognized as the onset of severe shock. They were out of time for debate or doubt. "This is going to hurt," she told Jackson, leaning close to his ear. "But I'm going to fix you up, okay? I need you to stay with me." Jackson managed a weak nod, his eyes focusing on her face with desperate trust. It was a look Maria had seen too many times before, the absolute faith that wounded soldiers placed in their medics, the belief that somehow she could work miracles with nothing more than bandages and determination. Today, she was going to prove that faith wasn't misplaced. The first incision was always the hardest. Not technically, Maria's hands were steady and sure, but psychologically, once she made that cut, there was no going back. She would either save Jackson's life, or she would be responsible for his death. Either way, her career would never be the same. The scalpel sliced through skin and muscle tissue with surgical precision, revealing the damaged artery beneath. Blood welled up immediately, but Maria had expected that. She'd studied Jackson's wound for the past 20 minutes, mapping out her approach, identifying the likely points of damage based on the shrapnel trajectory. "Clamp," she said, extending her hand toward Peterson. The young private fumbled with the instruments before passing her the right tool, his hands shaking slightly. "Relax," Maria said, not taking her eyes off the surgical site. "Jackson's depending on us to stay calm." She could feel the weight of everyone's attention as she worked. Rodriguez stood at the head of the stretcher, dividing his attention between watching her operate and monitoring the radio for updates on the tactical situation. Martinez maintained pressure on secondary bleeding sites, his face a mask of concentration. Thompson called out vital signs in a steady rhythm that helped Maria track Jackson's condition without having to look away from her work, but it was Peterson's reaction that interested her most. The young soldier's initial terror was giving way to fascination as he watched her hands move with confident precision. She could see the moment when his doubt transformed into respect, the same transformation she'd witnessed in others over the years, but never quite like this. "Sergeant," Peterson said quietly, "this is incredible. I had no idea medics could do this." "Most of us can't," Maria replied, using microsutures to repair a severed vessel. "That's why it's important to always keep learning, always pushing yourself to be better than what people expect." The philosophy that had guided her entire military career, summed up in a single sentence. Maria had never been content to be just anything. Just a medic, just a woman, just a soldier from the barrio who should be grateful for any opportunity the Army gave her. She'd insisted on being exceptional instead, especially when that insistence made others uncomfortable. 20 minutes into the surgery, Jackson's vital signs began to stabilize. The immediate threat of exsanguination was over, but Maria still had significant repair work ahead of her. The shrapnel had damaged not just the major artery, but several smaller vessels and a portion of the muscle tissue. Each required careful attention to prevent complications later. "How's it looking out there?" she asked Rodriguez, not taking her eyes off her work. "Heavy fighting 2 blocks north, but it seems to be moving away from us," the captain replied. "Command wants to know our status for possible evacuation." "Tell them we'll be ready to move in 40 minutes, Maria said, beginning work on the damaged muscle tissue. "Jackson's going to need additional surgery at the field hospital, but he'll survive the transport now." 40 minutes? Rodriguez sounded surprised. "I thought surgery took hours." "Depends on the surgery. This is trauma repair, not elective procedure. Fast and effective is more important than perfect." Maria glanced up at him briefly. "Besides, we don't have the luxury of time." As if to emphasize her point, another mortar round exploded somewhere in the distance, close enough to rattle the windows but far enough away to avoid disrupting her work. Maria didn't even pause in her suturing. "Jesus," Peterson muttered. "How? Are you so calm?" "Practice," Maria said simply. "Plus, panicking won't help Jackson." But the truth was more complex than that. Maria had learned to channel her fear and uncertainty into focus and precision. Every racist comment from a drill sergeant, every sexist joke from a fellow soldier, every time she'd been passed over for recognition, all of it had forged her into someone who could perform flawlessly under pressure. She'd had to be twice as good to get half the respect, and that training was serving her well now. 30-5 minutes after making her first incision, Maria completed the final suture and stepped back from the table. Jackson's color was returning to normal, his breathing had stabilized, and his vital signs showed steady improvement. "That's it," she announced, stripping off her bloody gloves. "He's stable for transport." The ad station fell silent except for the distant sounds of combat. Everyone stared at Jackson, then at Maria, as if they couldn't quite believe what they'd just witnessed. "I'll be damned," Rodriguez said finally. "Santos, that was incredible." Maria began cleaning her instruments, her movements automatic after years of practice. "It was necessary," she corrected. "Jackson needed surgery, so I gave him surgery. But you're—" Peterson started, then stopped, clearly struggling with how to finish the sentence. "I'm what?" Maria asked, though she already knew what he was going to say. "You're just a medic," Peterson said, then immediately looked embarrassed. "I mean, I didn't mean. That's not what I—" "Yes, it is what you meant," Maria said, but her tone wasn't angry. "And you're right, I am just a medic. But just a medic saved Jackson's life today. Maybe it's time to reconsider what that phrase actually means." She finished packing her surgical kit, the same kit her superiors had told her she'd never need. The same instruments that had been dismissed as pretentious and unnecessary. The same tools that had just performed a miracle in a bombed-out school, building while mortar fell around them. "Transport's inbound," Rodriguez announced, listening to his radio. "ETA 10 minutes. "Good," Maria said, checking Jackson's bandages one final time. "He's ready to go." As they prepared Jackson for transport, Maria reflected on how this moment would change things. Word would spread, as it always did in the military. By tomorrow, every soldier in the battalion would know that Staff Sergeant Maria Santos had performed emergency surgery under fire and saved a life that would have been lost otherwise. But she also knew that one heroic moment wouldn't erase 5 years of being dismissed and underestimated. There would be investigations, questions about her qualifications, debates about whether she'd exceeded her authority. Some would see her actions as heroic. Others would view them as reckless insubordination. None of that mattered right now. What mattered was that Jackson would go home to his family instead of coming home in a flag-draped coffin. What mattered was that she'd proven to herself once again that she was capable of more than anyone gave her credit for. The sound of helicopter rotors grew louder as the medical evacuation aircraft approached their landing zone. Maria helped load Jackson onto the stretcher, her hand briefly squeezing his shoulder in reassurance. "Thank you," Jackson whispered, his voice still weak but much stronger than it had been an hour earlier. "Just doing my job," Maria replied, then smiled slightly, all of it. As the helicopter lifted off, carrying Jackson toward definitive medical care, Maria turned back toward the aid station. There would be other casualties, other soldiers who needed her skills. And there would be more opportunities to prove that just a medic was capable of extraordinary things. The battle was far from over, but Maria Santos had already won the most important victory of her career. She'd saved a life, challenged expectations, and demonstrated that courage and competence could overcome any prejudice. Now she just had to do it again tomorrow. The investigation began before Jackson's helicopter had even reached the field hospital. Major Patricia Coleman, the battalion medical officer, arrived at the aid station 40 minutes after the evacuation, her expression a mixture of professional curiosity and barely concealed irritation. She was a career Army doctor who'd spent 15 years working her way up through the ranks, and she took the medical chain of command very seriously. "Staff Sergeant Santos," Coleman said without preamble, "I need to speak with you privately." Maria had been expecting this. She'd known that performing surgery without explicit orders would have consequences, regardless of the outcome. She followed Coleman to a corner of the aid station where they could speak without being overheard by the other medics. "Explain to me what happened here," Coleman said, her voice clinical and controlled. "Private Jackson presented with a severed femoral artery and extensive shrapnel wounds," Maria replied, falling back on medical terminology to keep the conversation professional. "Given the tactical situation and the estimated transport time to definitive care, I determined that immediate surgical intervention was necessary to prevent exsanguination." "You determined," Coleman repeated, emphasizing the word. "Staff Sergeant, you're not qualified to make that determination. That's a decision for a physician." "The nearest physician was pinned down in a different location," Maria pointed out. "Jackson had maybe 10 minutes before he went into irreversible shock. I had to make a choice." Coleman pulled out a tablet and began taking notes. "Walk me through the procedure you performed, step by step." For the next 20 minutes, Maria detailed every aspect of the surgery, from her initial assessment of Jackson's wounds to the final suture placement. Coleman asked pointed questions about her technique, her decision-making process, and her qualifications to perform such procedures. "Where did you learn surgical technique?" Coleman asked. "Army medical training. Covers basic surgical procedures," Maria replied. "I've also completed advanced courses in battlefield trauma and emergency surgery." "Which courses specifically?" Maria listed them. The Army Special Operations Combat Medic Course, a civilian EM to paramedic program she'd completed during leave, Advanced Trauma Life Support Certification, and half a dozen other specialized training programs she'd pursued on her own time and at her own expense. Coleman's eyebrows rose slightly. "That's extensive training for an enlisted medic." "I believe in being prepared," Maria said simply. "Prepared for what? To exceed your scope of practice?" The question hung in the air like smoke from the morning's battle. Maria chose her words carefully, knowing that her answer would likely determine her future in the Army. "Prepared to save lives when the situation demands it," she said finally. "Ma'am, with respect, Jackson would be dead right now if I hadn't acted. The tactical situation made standard evacuation procedures impossible. Sometimes you have to adapt." Coleman made more notes on her tablet, her expression unreadable. "The field hospital confirms that your surgical repair was technically sound," she said finally. "Dr. Chun was impressed with the quality of your work." Maria felt a flicker of relief, but Coleman wasn't finished. "However," the major continued, "performing surgery without proper authorization is a serious matter. Even if the outcome was positive, we can't have medics making independent decisions about when to exceed their training parameters." "So what happens now?" Maria asked. "Now we wait for the formal investigation. Until then, you're restricted to basic medical duties only. No surgical procedures, no matter how minor." Maria nodded, having expected as much. "Understood, ma'am." Coleman closed her tablet and studied Maria with something that might have been respect. "Off the record, Santos, that was impressive work. But the Army has rules and procedures for a reason. We can't have every medic deciding they're qualified to perform surgery just because they've taken a few extra courses." "I understand that, ma'am, but what would you have done? Let Jackson die while we waited for proper authorization?" "That's exactly the kind of thinking that's going to get you in trouble," Coleman said. "The military doesn't reward maverick behavior, even when it saves lives." After Coleman left, Maria returned to her duties feeling like she was walking through a minefield. Every decision, every procedure, every interaction with wounded soldiers, was now viewed through the lens of her unauthorized surgery. Her fellow medics watched her with a mixture of admiration and concern, unsure whether she was a hero or a loose cannon. Corporal David Martinez, her closest friend in the unit, pulled her aside during a lull in the action. "Santos, what were you thinking?" he asked, his voice filled with frustration. "You could end up court-martialed for this." "I was thinking about saving Jackson's life," Maria replied. "And it worked, this time," Martinez said. "But what about next time? What about your career? You were up for promotion to Sergeant First Class. You think that's going to happen now?" Maria had thought about that. She'd worked hard for 5 years, building a reputation as a reliable, skilled medic who could be counted on in any situation. The promotion to Sergeant First Class would have come with increased responsibility, better pay, and the respect that came with senior enlisted rank. Now all of that was in jeopardy, because she'd chosen to save a life instead of following protocol. "Maybe. The promotion doesn't matter as much as I thought it did," she said. Martinez stared at her like she'd lost her mind. "Are you kidding me? You've been working toward that promotion since the day you enlisted. It's all you've talked about for months." "That was before I realized what I was really capable of," Maria said. "Martinez, I performed a successful arterial repair under combat conditions with improvised equipment. Do you understand what that means? It means you're going to get kicked out of the Army for insubordination. Maybe, or maybe it means I've found my real calling." The conversation was interrupted by the arrival of another casualty, a young private who'd taken shrapnel in the abdomen. Maria moved to assess the wounded soldier, but Martinez caught her arm. "Remember what Coleman said," he warned. "Basic medical duties only." Maria examined the private's wounds and immediately recognized the signs of internal bleeding. The soldier needed surgery, just as Jackson had, but this time Maria's hands were tied. She could stabilize him, control external bleeding, start an but she couldn't do what really needed to be done. "We need to get him to the field hospital immediately," she told Captain Rodriguez. "He's got internal bleeding that needs surgical repair." "Can you do what you did for Jackson?" Rodriguez asked. "I'm not authorized to perform surgery," Maria replied, the words bitter in her mouth. "Since when has that stopped you?" "Since about 2 hours ago, when Major Coleman restricted me to basic medical procedures," Rodriguez swore under his breath. The tactical situation hadn't improved, if anything. Enemy activity had increased, making transport to the field hospital even more dangerous than it had been that morning. "How long can you keep him stable?" the captain asked. "Maybe an hour, if we're lucky," Maria said, working to establish access while monitoring the private's vital signs. "But every minute we wait increases the risk of complications." They called for immediate evacuation, but the response was the same as it had been with Jackson. Transport would be delayed due to enemy activity in the area. The difference was that this time, Maria couldn't take matters into her own hands. She watched the young private's condition deteriorate over the next 30 minutes, her hands literally tied by regulations that valued procedure over results. When the evacuation helicopter finally arrived, the soldier was barely conscious and showing signs of severe shock. "Will he make it?" Rodriguez asked as they loaded the stretcher. "I don't know," Maria admitted, and the uncertainty ate at her like acid. Later that evening, they received word that the private had died during transport, his internal injuries too severe to survive the flight to the field hospital. Maria stared at the casualty report, wondering if she could have saved him the way she'd saved Jackson. Martinez found her sitting alone in the aid station after midnight, staring at her surgical kit. "It's not your fault," he said quietly. "Isn't it?" Maria replied. "I had the skills to help him. I had the equipment. But I followed orders instead. You followed regulations. There's a difference. Tell that to his family." Martinez sat down beside her, understanding the weight she was carrying. Santos, you can't save everyone. You know that. But I could have. Saved him, Maria said, just like I saved Jackson. The only difference was that this time, I let bureaucracy make the decision instead of making it myself. And if you'd operated again, Coleman would have had you court-martialed before sunrise. Maybe that would have been worth it. They sat in silence for several minutes, listening to the distant sounds of combat that never seemed to completely stop. Finally, Martinez spoke again. What are you going to do? Maria closed her surgical kit and looked at her friend. I'm going to keep doing my job, she said. All of it. Even if it means risking your career? Especially if it means risking my career. The next morning brought news that would change everything. Word had spread through the battalion about Maria's unauthorized surgery, and the story had taken on a life of its own. Some versions painted her as a heroic lifesaver who'd gone above and beyond the call of duty. Others portrayed her as a reckless medic who'd endangered a patient by performing procedures she wasn't qualified to handle. The truth, as always, lay somewhere in between. Sergeant First Class Jennifer Hayes, the senior medic for Alpha Company, sought out Maria during the morning medical briefing. Santos, I need to ask you something, Hayes said, pulling her aside. Did you really perform arterial surgery in the field? Yes, Maria said simply. Hayes studied her with interest. I've been a medic for 8 years, and I've never had the guts to try something like that. What made you think you could pull it off? Training, Maria replied, and necessity. Training where? I've taken most of the same courses you have, and I sure as hell don't feel qualified to do surgery. Maria hesitated, then decided on honesty. I've been studying surgical techniques on my own time for the past 3 years. Reading textbooks, watching videos, practicing on tissue samples. I figured if I was going to be a medic, I should be the best medic I could be. Hayes shook her head in amazement. And here I thought you were just trying to show off with that fancy surgical kit you carry around. A lot of people thought that, Maria said. Well, they were wrong, weren't they? Before Maria could respond, Captain Rodriguez called for all medics to gather for a unit briefing. The news he delivered would reshape the entire dynamic of their deployment. Effective immediately, we're going to be operating with reduced medical support, Rodriguez announced. The field hospital is being relocated due to increased enemy activity, which means our transport times for serious casualties are going to increase significantly. Maria felt her stomach clench. Longer transport times meant more situations like Jackson's. More opportunities for soldiers to die from injuries that could be treated if someone was willing and able to provide advanced medical care in the field. What's the new transport time to definitive care? Hayes asked. Minimum of 90 minutes, possibly longer depending on the tactical situation, Rodriguez replied. 90 minutes. Maria had saved Jackson with maybe 5 minutes to spare. The math was simple and terrifying. Sir, Maria said, raising her hand, what are our guidelines for advanced medical procedures in extended transport situations? Rodriguez looked at her directly, and she could see that he understood exactly what she was asking. Guidelines remain the same, Sergeant. Medics are authorized to perform procedures within their scope of training as defined by Army medical protocols. It was a non-answer that gave her no guidance at all. The question was whether her scope of training included the surgical procedures she'd taught herself, or just the basic medical skills the Army had officially certified her to perform. After the briefing, Rodriguez pulled her aside once again. Santos, I need to know something, he said quietly. Are you prepared to do what you did for Jackson again, if the situation requires it? The question was loaded with implications. Rodriguez was essentially asking if she was willing to risk her career repeatedly to save lives, knowing that each unauthorized procedure would add to the case against her. If it means saving a soldier's life, yes, sir. Rodriguez nodded slowly. Then I need you to understand something. Officially, I can't authorize you to exceed your training parameters. But unofficially, if you save lives in situations where following standard protocol would result in preventable deaths, I'll support your decisions. It was as close to official approval as she was likely to get, and Maria understood the courage it took for Rodriguez to make that commitment. He was putting his own career on the line by supporting her. "Thank you, sir," she said. "Don't thank me yet," Rodriguez replied. "This is going to get complicated before it gets better." He was right. That afternoon, Maria received orders to report to Major Coleman for another interview, this time with a representative from the Inspector General's office present. The formal investigation was beginning, and the stakes were getting higher, but as she prepared for the interview, Maria felt a sense of clarity she hadn't experienced in years. For the first time since enlisting, she knew exactly who she was and what she was meant to do. She wasn't just a medic, she was a surgeon who happened to wear a medic's uniform. And if the Army couldn't accept that distinction, perhaps it was time to find an organization that could. The battle for respect had been going on for 5 years. Now it was about to become a war. We're deep into this incredible story now, and I hope you're as captivated as I am by these unfolding events. The amount of effort that goes into researching, writing, and narrating these novel-length stories is immense. We're talking about creating content equivalent to a published book. But it's worth it to bring you stories that truly engage and transport you to another world. If you're enjoying this journey so far, please take a second to like this video and share it with friends who appreciate great storytelling. Your support means everything and helps us continue creating these detailed, epic narratives. We still have so much more to discover together. So let's see how this situation unfolds. The Inspector General's representative was a thin, serious man named Lieutenant Colonel James Harrison, who had the kind of military bearing that suggested he'd never met a regulation he didn't love. He sat across from Maria in a commandeered office space, a digital recorder between them and a stack of documents at his elbow. "Staff Sergeant Santos," Harrison began, his voice professionally neutral. "You understand that this interview is part of a formal investigation into allegations that you exceeded your scope of practice while providing medical care in a combat zone." "I understand, sir," Maria replied, sitting at attention despite not being required to do so. "For the record, please state your military occupational specialty and current rank." "Staff Sergeant Maria Santos, 68W Healthcare Specialist, United States Army." Harrison made notes on his tablet. "And please describe your understanding of the scope of practice for a 68 West healthcare specialist in combat situations." Maria had prepared for this question, knowing it would be central to the investigation. A 68W is trained to provide emergency medical care, trauma stabilization, patient evacuation, and basic life support in field conditions. We're also trained in basic surgical procedures, including wound closure, airway management, and emergency interventions necessary to preserve life until the patient can be transferred to definitive care. "Basic surgical procedures," Harrison repeated. "Would you consider arterial repair to be a basic surgical procedure?" "In this case, yes, sir. The procedure I performed was a direct repair of a severed femoral artery using standard surgical techniques. It's covered in the Special Operations Combat Medic curriculum, which I completed 18 months ago." Harrison's eyebrows rose slightly. "You're SOCM qualified?" "Yes, sir. Along with advanced trauma life support, pre-hospital trauma life support, and several civilian emergency medical certifications." Major Coleman, who had remained silent until now, leaned forward. "Staff Sergeant, while your additional training is commendable, it doesn't necessarily authorize you to perform procedures independently that would normally require physician oversight." "Ma'am, with respect," Maria said, "the tactical situation made physician oversight impossible. Private Jackson was going to die without immediate intervention. I had the training and equipment necessary to save his life, and the standard of care in a combat zone is different from the standard in a hospital setting. Harrison continued taking notes. Tell me about your equipment. Where did you acquire surgical instruments beyond the standard medic kit? I purchased them myself, sir. Over the past 3 years, I've built a comprehensive surgical kit using my own money. All instruments are sterile, properly maintained, and appropriate for field use. Why did you feel the need to acquire these instruments? Maria paused, choosing her words carefully. Because I believe a medic's primary responsibility is to preserve life by whatever means necessary. Standard medic equipment is adequate for most situations, but combat presents unique challenges that sometimes require more advanced interventions. And you felt qualified to make that determination? Sir, I felt qualified to save Private Jackson's life when no one else was available to do so. The alternative was to watch him die while following protocols designed for situations with readily available physician oversight. Harrison and Coleman exchanged glances. The interview continued for another hour, covering every aspect of the VA. Surgery, Maria's training background, and her decision-making process. When it was over, Maria felt like she'd been dissected with the same precision she'd used on Jackson's wounds. That will be all for now, Staff Sergeant, Harrison said finally. You'll be notified of any further requirements as the investigation proceeds. Sir, may I ask what the potential outcomes are? Harrison's expression didn't change. That depends on the findings of the investigation. Penalties could range from formal counseling to court-martial, depending on whether your actions are determined to have violated the Uniform Code of Military Justice. As Maria left the interview, she found Captain Rodriguez waiting for her outside the building. How did it go? He asked. About as well as expected, Maria replied. They're not exactly impressed with my initiative. The Army rarely is, Rodriguez said, but there's something else you need to know. We just received intelligence that suggests enemy forces are planning a major offensive in this sector. If they're right, we're going to see a lot more casualties in the coming days. Maria felt her chest tighten. More casualties meant more impossible choices, more situations where following protocol might mean letting soldiers die. What's the timeline? She asked. Preparing and narrating this type of story took us long efforts and hard work. So if you are enjoying the story, please consider subscribing to our channel. Could be as early as tomorrow night. Command is considering pulling us back to a more defensible position, but that would leave a gap in medical coverage for the forward units. We can't abandon the forward units, Maria said immediately. That's what I told the colonel, Rodriguez replied. But he's concerned about our ability to handle mass casualties with our current medical capabilities. The unspoken question hung between them. Could Maria be counted on to provide advanced medical care if the situation demanded it, despite the ongoing investigation? Captain, if soldiers are dying and I have the ability to save them, I'm going to save them, Maria said quietly. Investigation or no investigation? Rodriguez nodded, having expected that answer. I figured as much. Just be careful, Santos. You've already got a target on your back. Don't make it any bigger than it has to be. That evening, Maria found herself in the company of Dr. Patricia Chun, the surgeon who had been pinned down during Jackson's crisis. Dr. Chun had specifically requested to meet with her, which had surprised everyone given the ongoing investigation. They sat in a quiet corner of the mess tent, both nursing cups of coffee that had long since gone cold. I reviewed your surgical repair of Private Jackson, Dr. Chun said without preamble. It was exceptional work. Thank you, ma'am, Maria replied, unsure where the conversation was heading. Where did you train? And don't give me the standard line about Army medical courses. I've seen the work of hundreds of medics over the years, and none of them could have performed that procedure. Maria found herself telling Dr. Chun the same story she'd told Major Coleman and Lieutenant Colonel Harrison, but this time the reaction was different. Instead of skepticism or concern about protocol violations, she saw genuine interest and professional respect. "You taught yourself surgical technique by studying textbooks and watching videos?" Dr. Chun asked. "Partly. I also arranged to observe surgeries during my leave time at civilian hospitals. A few surgeons were willing to let me watch and ask questions." "And you practiced on tissue samples?" "Pig's feet from the grocery store, mostly. Sometimes I could get more sophisticated training materials from veterinary suppliers." Dr. Chun shook her head in amazement. "That's the most dedicated approach to self-education I've ever heard of. Why didn't you just apply to medical school?" "Financial reasons mainly. My family couldn't afford it, and I didn't have the grades for a full scholarship." "What about the Army's medical school program?" Maria had looked into that option, but the competition was fierce, and the selection criteria favored officers with perfect records and strong recommendations. Her unconventional approach to expanding her skills had worked against her in that context. "I applied twice," she admitted. "Both times I was told that my application showed promise, but that I needed more traditional medical experience." "More traditional," Dr. Chun repeated. "Meaning they wanted you to stay in your lane as a medic instead of pushing boundaries." "Something like that." Dr. Chun was quiet for several minutes, apparently lost in thought. Finally, she looked up at Maria with an expression of determination. "I want to make you an offer," she said. "When this deployment ends, I'm returning to my position as Chief of Surgery at Walter Reed. I could arrange for you to be assigned to our surgical department as a technician with opportunities to observe and assist in complex procedures." Maria's heart jumped. Walter Reed was one of the premier military medical facilities in the world, and the opportunity to work directly with surgical teams there would be invaluable. "Ma'am, that's incredibly generous, but the investigation will run its course." Dr. Chun interrupted. "And regardless of the outcome, you've demonstrated skills and dedication that shouldn't be wasted. The military needs medics like you, even if they don't always know it. What would I be doing as a surgical technician?" "Officially?" "Assisting with surgical procedures, maintaining equipment, preparing operating rooms." "Unofficially?" "Learning from some of the best surgeons in the military. And if you prove yourself there, I might be able to help you apply for the physician assistant program." The PA program was something Maria had dreamed about, but never thought was realistically within reach. Physician assistants could perform many of the same procedures as doctors, with much of the independence she craved, but within the official framework of military medicine. "Why are you offering me this?" Maria asked. "Because talent like yours is rare, and the military can't afford to waste it over bureaucratic concerns about following protocol," Dr. Chun replied. "You saved a life under impossible circumstances using skills you developed on your own initiative. That's exactly the kind of thinking we need more of, not less." Before Maria could respond, the conversation was interrupted by the sound of incoming artillery. Both women hit the ground instinctively as explosions erupted close enough to shake the mess tent. "So much for tomorrow night," Dr. Chun muttered as they scrambled for the exit. The offensive had begun early, over the next 6 hours. Maria found herself in the middle of the most intense combat she'd experienced in 3 deployments. The aid station was overwhelmed with casualties as enemy forces launched coordinated attacks on multiple positions. Simultaneously, bodies filled every available space in the makeshift medical facility. Soldiers with gunshot wounds, shrapnel injuries, burns, and blast trauma arrived faster than the small medical team could process them. Maria moved from patient to patient, triaging injuries and providing emergency care while mortar rounds continued to fall outside. "Santos," Captain Rodriguez called out over the noise. "I've got a soldier with a sucking chest wound and another with a severed limb. Which one do you want? It was exactly the kind of impossible choice that defined combat medicine. Both patients needed immediate attention, but there was only one of her. Give me the chest wound, Maria replied, already moving toward the indicated patient. Martinez can handle the amputation until I can get there. The soldier with the chest wound was a young sergeant from Bravo Company, conscious but struggling to breathe as air leaked into his chest cavity through a puncture wound. Maria quickly assessed the injury and began preparing for a procedure. She'd never performed in combat conditions, but had studied extensively. I need to decompress his chest, she told Rodriguez. This is going to get complicated. How complicated? I need to insert a tube into his chest cavity to allow the trapped air to escape. It's usually done in a sterile operating room, not in a tent under artillery fire. Rodriguez looked around at the chaos surrounding them. Do what you have to do. Maria began preparing her equipment, but her hands froze as she realized the implications. She was about to perform another unauthorized procedure, this time with multiple witnesses and in the middle of an active investigation. If she went ahead, there would be no ambiguity about her willingness to exceed her official authority. But the sergeant was dying. She could see it in his labored breathing, his pale skin, the way his lips were turning blue from lack of oxygen. Sergeant, the wounded soldier whispered, grabbing her wrist with surprising strength. Please don't let me die. Maria looked into his eyes and saw the same desperate trust she'd seen in Jackson's face. The same absolute faith that she could work miracles with nothing more than determination and skill. She made her decision. Rodriguez, I need you to maintain pressure on his other wounds while I work, she said, pulling on sterile gloves with practiced efficiency. This is going to hurt, but it'll save your life, she told the wounded sergeant. The chest tube insertion took 12 minutes under conditions that would have been challenging for a seasoned surgeon in a proper operating room. Enemy fire continued to impact around the aid station. The lighting was poor, and Maria had to work around multiple other injuries on the same patient. But when she was finished, the sergeant's breathing immediately improved. His color returned to normal, and his vital signs stabilized. Outstanding work, Dr. Chun said from behind her. Maria turned to see the surgeon watching with professional admiration. Textbook chest tube placement under impossible conditions. Dr. Chun, I thought you were evacuated with the critical patients. Transport was delayed due to enemy activity. I've been helping with triage. Dr. Chun looked around at the controlled chaos of the aid station. You've performed 3 advanced surgical procedures tonight. All successful. Maria realized she'd been so focused on treating patients that she'd lost track of her own actions. In addition to the chest tube, she'd also repaired a lacerated spleen and performed an emergency tracheotomy on a soldier with severe facial trauma. I was just doing what needed to be done, she said. That's exactly my point, Dr. Chun replied. You've been doing what needed to be done, regardless of the bureaucratic consequences. That's what good surgeons do. The battle continued for another 4 hours, during which Maria treated 17 casualties and performed 6 procedures that would normally require physician oversight. By the time the enemy offensive was repelled, she had saved at least 4 lives that would have been lost under standard medical protocols. But she had also provided Lieutenant Colonel Harrison with enough evidence to court-martial her 6 times. As dawn broke over the battlefield, Maria sat exhausted in the aid station, surrounded by the detritus of the night's medical work. Her uniform was covered in blood, her hands were shaking from exhaustion and adrenaline, and her surgical kit was completely depleted. Captain Rodriguez found her there an hour later, staring at the empty instrument cases. Casualty report came in, he said quietly. 17 wounded treated at this location, 0 fatalities. That's good, Maria said, though she felt too tired to process the significance. Santos, do you understand what you did last night? I treated wounded soldiers. You saved 17 lives in 6 hours while under enemy fire, without any physician oversight or official authorization. Hell, half those procedures would be challenging for trained surgeons in a proper hospital. Maria looked up at him, understanding the weight behind his words. And now they have all the evidence they need to destroy my career. Maybe, Rodriguez agreed. Or maybe they'll finally realize what they have in you. Before Maria could respond, Major Coleman appeared in the entrance to the aid station, accompanied by Lieutenant Colonel Harrison and Dr. Chun. The three of them surveyed the scene with expressions that ranged from amazement to concern. Staff. Sergeant Santos, Harrison said formally, I need you to provide a detailed report of all medical procedures performed during last night's engagement. Maria slowly got to her feet, swaying slightly from exhaustion. Sir, I performed emergency medical interventions as required to preserve life and prevent permanent disability. Detailed documentation will be available as soon as I complete the required paperwork. That's not what I'm asking for, Harrison said. I need to know exactly which procedures you performed that exceeded your authorized scope of practice. The question hung in the air like a challenge. Maria could provide a sanitized report that minimized her actions, or she could tell the complete truth and face the consequences. She chose truth. Sir, I performed 3 chest tube insertions, 2 arterial repairs, 1 splenectomy, 2 emergency tracheotomies, and 1 bowel resection. All procedures were performed to prevent imminent death or permanent disability when physician oversight was unavailable. Harrison's eyes widened as he made notes. Staff Sergeant, are you aware that several of those procedures would normally require board-certified surgeons to perform? Yes, sir. I'm also aware that 17 soldiers are alive this morning who wouldn't be if I'd limited myself to basic medical procedures. That's not the point, Harrison began, but Dr. Chun interrupted him. Actually, Colonel, I think that's exactly the point, she said. Staff Sergeant Santos performed life-saving surgery under combat conditions with a 0% mortality rate. Those results would be impressive for a trauma team in a Level 1 trauma center, much less a field medic working alone under fire. Dr. Chun, while I appreciate your perspective, the issue here is one of military discipline and proper authority, Harrison replied. We can't have enlisted personnel making independent decisions about when to exceed their training parameters, regardless of the outcomes. Even when those decisions save lives that would otherwise be lost. Even then, Maria listened to the debate about her future with growing frustration. They were talking about her as if she wasn't standing right there, as if her own thoughts and feelings about her actions were irrelevant to the discussion. Sir, she said, interrupting the conversation. May I say something? Harrison looked annoyed at the interruption, but nodded. Go ahead, Staff Sergeant. I understand the Army's concern about discipline and following proper authority. I understand that my actions may have violated regulations. But I need you to understand something too. Maria looked directly at each of the 3 officers. I became a medic to save lives. That's my primary mission, my core responsibility, and my personal commitment to every soldier I serve with. If following regulations means watching soldiers die when I have the ability to save them, then the regulations are wrong. Staff Sergeant, Harrison began, but Maria wasn't finished. I'm not asking for special treatment or exemption from military discipline. If the Army decides to court-martial me for saving lives, then that's the price I'll pay. But I won't apologize for doing everything in my power to bring soldiers home alive. The aid station fell silent, except for the distant sounds of helicopters evacuating the previous night's casualties. Finally, Dr. Chun spoke. Colonel Harrison, I'd like to make a formal recommendation. What kind of recommendation? That's staff. Sergeant Santos be immediately enrolled in the Physician Assistant Program with a specialization in trauma surgery. Her demonstrated skills and dedication are exactly what military medicine needs. Dr. Chun, I appreciate your assessment, but that's not how the system works. There are procedures, prerequisites, formal application processes, all of which are designed to identify candidates with the potential to excel in advanced medical roles. Dr. Chun interrupted. Staff Sergeant Santos has already demonstrated that potential under the most demanding circumstances possible. Major Coleman, who had been quietly observing the exchange, finally spoke up. There is precedent for accelerated promotion and training for exceptional enlisted personnel. The Battlefield Commission Program allows for rapid advancement when circumstances warrant it. A battlefield commission to physician assistant? Harrison asked. I'm not sure that's even possible. It's possible, Coleman replied. Difficult, but possible. It would require endorsements from multiple senior officers and demonstration of exceptional performance under combat conditions. Maria felt a glimmer of hope, but tried not to let it show. The conversation was moving in a direction she hadn't expected, but she knew that military bureaucracy could change direction just as quickly. What would that process involve? She asked. First, completion of the current investigation, Harrison said. Then, if the findings support it, formal recommendations from your chain of command. Finally, review by a promotion board and acceptance into the PA program. And if the investigation doesn't support it? Harrison's expression was grim. Then you face potential court-martial for exceeding your authority and violating military regulations. The stakes couldn't be clearer. Maria's unauthorized surgeries would either launch her career to new heights or destroy it completely. There would be no middle ground, no compromise position that satisfied everyone. How long until the investigation is complete? She asked. 2 weeks, possibly less, Harrison replied. In the meantime, you're restricted to basic medical duties only. Maria nodded, understanding the irony. Just when her skills were most desperately needed, she was being prevented from using them. But she also understood that the next 2 weeks would be crucial in determining not just her own future, but the future of every medic who might face similar situations. As the 3 officers prepared to leave, Dr. Chun pulled Maria aside for a private word. Whatever happens with the investigation, my offer stands, she said quietly. Walter Reed can use someone with your skills and dedication. Thank you, ma'am. That means more than you know. Just remember something, Staff Sergeant. You've already proven that you're more than just a medic. Now you need to prove it to the people who make the decisions. As Dr. Chun walked away, Maria reflected on how much had changed in just 3 days. She'd gone from being an overlooked enlisted medic to being the center of a military investigation that could reshape how the Army viewed advanced medical training for enlisted personnel. The battle for recognition was far from over. But at least now she knew she wasn't fighting it alone. The summons came at 0600 hours on a Tuesday morning, delivered by a stone-faced military police officer who waited while Maria dressed and gathered her personal effects. She was being transferred to the main forward operating base for what the orders described as continued investigation and administrative review. Translation: her fate was about to be decided by people who had never seen combat, never treated wounded soldiers under fire, and never faced the impossible choice between following orders and saving lives. The helicopter ride to the FOB gave Maria time to think about everything that had led to this moment. In the 2 weeks since the investigation began, she'd been restricted to basic medical duties while watching other medics struggle with casualties that she could have saved. 3 soldiers had died during that period, not from lack of effort or dedication from their medics, but from injuries that required surgical intervention beyond the scope of standard field medicine. Each death had been a knife in her heart, a reminder of the cost of rigid adherence to protocols that weren't designed for the realities of modern combat. Now, as the FOB came into view below, Maria wondered if her stand for surgical autonomy had been worth the price she was about to pay. Colonel Michael Hendricks, the base commander, was waiting for her when she arrived. He was a career infantry officer who had worked his way up through the ranks, earning respect through competence and fairness rather than political maneuvering. His reputation among enlisted personnel was solid, which gave Maria a small measure of hope. "Staff Sergeant Santos," Hendricks said as she saluted. "I've been hearing quite a lot about you lately." "Yes, sir," Maria replied, unsure what else to say. "Walk with me." They strolled through the base, past rows of armored vehicles and bustling activity centers, while Hendricks spoke in the casual tone that senior officers used when they wanted to have real conversations rather than formal interviews. "Tell me something, Santos. What do you think makes a good soldier?" The question seemed unrelated to her situation, but Maria sensed it was important. "Following orders, completing the mission, and taking care of your people, sir. That's the textbook answer. But what happens when those three things conflict with each other?" Maria thought about Jackson lying on the stretcher, about the private who had died during transport, about all the soldiers she'd saved by exceeding her official authority. "Then you have to decide what's most important, sir." "And what's most important to you?" "Taking care of soldiers, sir. Everything else is secondary." Hendricks nodded approvingly. "That's what I thought you'd say. It's also what everyone who served with you has told me." They stopped walking outside a building Maria didn't recognize. The sign by the door indicated it was the base legal office. "Sir, am I under arrest?" she asked. "No, Santos. You're about to receive some news that's going to change your life. The question is how you're going to handle it." Inside the legal office, Maria found herself facing a panel of 5 officers: Lieutenant Colonel Harrison from the Inspector General's office, Major Coleman, Dr. Chun, Colonel Hendricks, and a brigadier general she didn't recognize. "Staff Sergeant Santos," the general said. "Please be seated. I'm Brigadier General Sarah Matthews, Deputy Surgeon General for the Army Medical Command." The highest-ranking medical officer Maria had ever been in the same room with, and she was here to discuss Maria's case personally. The implications were staggering. "General," Maria said, taking the indicated seat and trying to keep her voice steady. "Staff Sergeant, the investigation into your actions has been completed. The findings are complex." General Matthews opened a thick folder and began reading from official documents. "The investigation concludes that you performed multiple surgical procedures without proper authorization, exceeded your scope of practice as defined by Army regulations, and made independent medical decisions that should have been made by qualified physicians." Maria's heart sank. Everything she'd feared was about to come true. "However," General Matthews continued, "the investigation also concludes that your actions directly saved the lives of at least 11 soldiers who would have died under standard medical protocols. Your surgical technique has been reviewed by board-certified surgeons and found to be exceptional. Your decision-making process, while unorthodox, was medically sound and appropriate for the tactical situations you faced." Maria wasn't sure how to interpret the mixed message. Had she violated regulations or not? "Furthermore," the general said, "your case has prompted a comprehensive review of medical protocols for forward-deployed units. It's become clear that current regulations don't adequately address the reality of modern combat medicine, where transport times to definitive care can be prohibitively long and medics with advanced training may be the only medical personnel available." Lieutenant Colonel Harrison leaned forward. "Staff Sergeant, you've created what we might call a constructive crisis. Your actions were technically violations of existing regulations, but they've exposed serious flaws in those regulations." "What does that mean for me, sir?" Maria asked. General Matthews exchanged glances with the other officers before responding. "It means you have a choice to make. We can proceed with disciplinary action under existing regulations, which would likely result in administrative punishment. And the end of your military career, or, Maria prompted when the general paused. Or you can accept assignment to a new program we're establishing, called the Advanced Combat Medical Specialist Initiative. You would be the first person enrolled. Dr. Chun smiled slightly. It's what I was trying to arrange informally, but now it's becoming official Army policy. What would the program involve? Maria asked. General Matthews consulted her documents. 18 months of intensive medical training, including surgical residency rotations at military medical centers, completion of the physician assistant program, and specialization in battlefield trauma surgery. Upon completion, you would be commissioned as a warrant officer with authority to perform advanced surgical procedures in combat zones. Maria felt like the room was spinning. A warrant officer commission would make her the senior medical authority in any unit she was assigned to, with the official backing to make the kinds of decisions she'd been making unofficially. What's the catch? She asked, knowing there had to be one. Several catches, Harrison replied. First, you'd be setting precedent for an entirely new military occupation specialty. There will be intense scrutiny of your performance, both during training and afterward. Second, the training will be extraordinarily demanding. We're talking about condensing normally separate programs into an integrated curriculum that will test your limits. Third, if you fail to complete the program successfully, you'll be discharged from the military. No second chances, Colonel Hendricks added. This is an all-or-nothing proposition. Maria considered the offer carefully. It was everything she'd dreamed of and more official recognition of her surgical skills, authority to make medical decisions independently, and the opportunity to train other medics in advanced procedures. But it was also terrifying in its scope and potential for failure. May I ask why you're offering me this opportunity? She said. Because you've demonstrated that exceptional medics with surgical training can save lives that would otherwise be lost, General Matthews replied. The Army needs more people like you, but we need them to operate within official channels rather than as freelance surgeons. Also, Dr. Chun added with a slight smile, because you've already proven you're not going to let regulations stop you from saving lives. We'd rather work with that tendency than against it. The room fell silent while Maria processed the offer. It was the chance of a lifetime, but accepting it would mean leaving behind everything familiar and venturing into uncharted territory. How long do I have to decide? She asked. Right now, General Matthews said. The program needs to start immediately if it's going to be ready for the next deployment cycle. Your decision determines whether this initiative moves forward or gets shelved indefinitely. No pressure at all, Maria thought wryly. Her choice wouldn't just affect her own career, it would determine whether future medics would have the opportunity to receive advanced surgical training. She thought about Jackson, fighting for his life on a stretcher while mortar fell around them. She thought about all the soldiers she'd saved by exceeding her authority, and all the ones she might save in the future with proper training and official backing. She thought about her grandmother, encouraging her to reach for opportunities. That seemed impossible. I accept, Maria said. General Matthews smiled for the first time since the meeting began. Outstanding. Dr. Chen will be your primary mentor during the program, and you'll begin with a rotation at Walter Reed in 2 weeks. What about my current unit? Maria asked. You'll be temporarily replaced while you're in training, Colonel Hendricks replied. But there's something else. Part of the program involves developing training protocols for other medics. You'll be helping to create the curriculum that will prepare the next generation of advanced combat medical specialists. The implications hit Maria like a physical blow. She wouldn't just be advancing her own career, she'd be helping to ensure that future medics would have the training and authority to save lives without risking court-martial. One more thing, General Matthews said, standing to indicate the meeting was over. Your first assignment after completing the program will be to return to a forward combat unit as the senior medical officer. You'll be putting everything you learned to the test under the same conditions where you first proved your capabilities. As the meeting broke up, Dr. Chun pulled Maria aside for a private conversation. "Are you ready for this?" she asked. "The next 18 months are going to be brutal. You'll be learning in 2 years what normally takes 4 to 6 years of medical school and residency." "I'm ready," Maria said, though she wasn't entirely sure that was true. "Good, because the Army is betting a lot on you. If this program succeeds, it could revolutionize combat medicine. If it fails, it won't fail," Maria said with more confidence than she felt. "I believe that," Dr. Chun replied. "But belief and reality are two different things. You're going to face challenges you can't imagine from people who want to see you fail. The medical establishment doesn't like change, and you represent a fundamental change in how we approach military medicine." As Maria prepared to leave the FOB and begin her new life, she reflected on the journey that had brought her to this point. 6 months ago, she'd been just a medic trying to prove she belonged. Now she was about to become the first person in a new military occupation specialty, with the opportunity to reshape how the Army trained combat medics. But first, she had to prove she could handle the most demanding medical training the military had to offer. The helicopter ride back to pack her personal effects gave her time to think about what she was leaving behind. Her unit, her friends, the familiar routine of forward deployed life, all of it would be replaced by the unknown challenges of advanced medical training. Captain Rodriguez was waiting for her when she landed. "So?" he asked simply. "I'm going to medical school," Maria replied, still not quite believing it herself. Rodriguez grinned and shook her hand. "Outstanding. When do you leave?" 2 weeks. "Then we better make sure these 2 weeks count. I've got 17 medics who need to learn everything you can teach them before you go." Maria spent her final 2 weeks with the unit conducting intensive training sessions for every medic in the battalion. She taught them advanced trauma assessment, emergency surgical procedures, and most importantly, how to think beyond the limitations of standard protocols when soldiers' lives were at stake. On her last day, the entire medical unit gathered to see her off. Corporal Martinez presented her with a gift from all the medics, a new surgical kit, more comprehensive than anything she'd assembled herself. "For when you come back," he said, "we know you'll put it to good use." As the transport helicopter lifted off, carrying Maria toward her new future, she looked down at the aid station where she'd first proven that she was more than just a medic. The building looked small from the air, insignificant in the vast landscape of the combat zone, but she knew that everything important in her life had changed within those canvas walls. She'd found her calling, challenged the system, and won the opportunity to become something the Army had never seen before. Now, she just had to prove she was worthy of the chance. We're approaching the climactic moments of this epic tale, and the tension is at its peak. Creating stories of this scope and detail requires not just writing talent, but careful plotting, character development, and attention to every narrative thread. We've journeyed through nearly 40,000 words together, and I hope every moment has kept you engaged. If this story has drawn you in and kept you listening, please show your appreciation by liking this video and subscribing to our channel. Share this epic with anyone who loves immersive storytelling, and hit that notification bell for more incredible adventures. Now let's witness how everything comes together in these final, crucial moments. Walter Reed National Military Medical Center was a universe away from the makeshift aid stations and field hospitals where Maria had cut her teeth. As a combat medic, the pristine hallways, state-of-the-art equipment, and academic atmosphere felt almost alien after years of providing medical care in dusty tents, under enemy fire. But the transition to advanced medical training proved even more challenging then. The environment. Dr. Michael Brennan, the chief surgical resident who had been assigned as one of Maria's instructors, made his opinion clear from their first meeting. "I don't care what you accomplished in some godforsaken combat zone," he said, looking down at her with the kind of condescension that academic physicians reserved for enlisted personnel who thought they belonged in medical settings. "This is real medicine, practiced by real doctors who've earned their credentials through years of proper education." Maria stood at attention in the surgical preparation area, wearing scrubs that felt foreign after years in combat fatigues. Around her, medical students and residents went about their business with the casual confidence that came from belonging in their environment. She had never felt more out of place in her life. "Dr. Brennan," she replied carefully, "I understand that my background is unconventional. I'm here to learn and contribute however I can." "Your background is non-existent," Brennan corrected. "You're a medic with some field experience trying to play surgeon. The fact that the Army is wasting resources on this experiment doesn't mean I have to pretend you're qualified to be here." The first month of training was a systematic humiliation. Every procedure Maria performed was critiqued harshly. Every decision she made was questioned publicly. Every small mistake was magnified into evidence that the entire advanced combat medical specialist program was a foolish waste of time and money. Dr. Brennan seemed to take particular pleasure in assigning her the most menial tasks: cleaning equipment, organizing supplies, observing procedures from the back of crowded operating rooms where she couldn't see what was happening. "Santos, you're responsible for instrument sterilization today," he would announce in front of other residents. "Try not to contaminate anything important." The other medical students and residents took their cue from Brennan's attitude. Maria found herself isolated, excluded from study groups and informal learning opportunities. When she tried to ask questions about procedures or techniques, she was dismissed with comments about how field medics wouldn't understand complex medical concepts. But the worst part wasn't the professional ostracism, it was the creeping doubt that maybe they were right. The volume of information required for the accelerated program was staggering. Maria spent 18 hours a day studying anatomy, pharmacology, surgical techniques, and diagnostic procedures. She fell asleep over textbooks and woke up with medical journals stuck to her face. Her small quarters were wallpapered with anatomical charts and procedure diagrams. Yet despite her efforts, she consistently fell behind in the academic portions of the program. The other students had undergraduate degrees in biology or chemistry, providing them with scientific foundations that Maria lacked. They spoke a language of molecular biology and biochemistry that she was still learning to understand. 3 months into the program, Dr. Chun called Maria into her office for a progress review that both of them knew would be critical. "How are you feeling about the training so far?" Dr. Chun asked, though her expression suggested she already knew the answer. "Honestly, ma'am, I'm struggling," Maria admitted. "The academic side is much more challenging than I expected. I feel like I'm constantly playing catch-up." Dr. Chun consulted Maria's evaluation reports, her expression growing more concerned as she read. "Dr. Brennan's assessments are not encouraging. He's recommending that you be removed from the program." Maria felt her stomach drop. After everything she'd been through, after all the soldiers she'd saved, after proving herself under the most demanding circumstances imaginable, she was about to be dismissed because she couldn't keep up with medical school academics. "What are the specific concerns?" she asked, though she was afraid to hear the answer. "Insufficient academic preparation, difficulty with complex medical concepts, inability to adapt to clinical learning environment." Dr. Chun read from the evaluation. "He's also noted concerns about your attitude and willingness to accept instruction from qualified physicians." "My attitude?" Maria said, her voice rising despite her efforts to stay calm. "Ma'am, I've been respectful and professional with everyone, even when they've made it clear I don't belong here. I believe that Dr. Chun said. "But perceptions matter in academic medicine, and the perception is that you're a combat medic, trying to shortcut your way into credentials you haven't earned." Maria stared at the floor, feeling the weight of failure settling over her like a heavy blanket. She'd been so focused on the opportunity the program represented that she'd underestimated the challenges of fitting into an academic medical environment. "Ma'am, what would it take for me to stay in the program?" Dr. Chun closed the evaluation folder and looked at Maria directly. "Honestly, a miracle. You're 6 months behind where you need to be academically, and Dr. Brennan has significant influence over the program's administration. Unless something changes dramatically, you'll be out of the program within the month." That night, Maria sat in her quarters surrounded by textbooks she couldn't seem to master, feeling more defeated than she had ever felt in combat. She'd survived mortar attacks, treated dozens of critically wounded soldiers, and performed life-saving surgery under impossible conditions. But she was being defeated by molecular biology and biochemistry. She thought about calling her family, but couldn't bear the thought of explaining that she'd failed at the opportunity of a lifetime. She thought about reaching out to her former unit, but knew they would be disappointed to learn that their faith in her had been misplaced. Instead, she picked up her phone and called the one person who might understand what she was going through. "Martinez," came the familiar voice of her former colleague. "Martinez," came the familiar voice of her former colleague. "It's Santos," Maria said, her voice barely above a whisper. "Santos, how's medical school treating you? Are you saving lives with fancy equipment instead of duct tape and determination?" Maria couldn't bring herself to answer immediately. Finally she managed, "I think I'm going to fail out." The silence on the other end stretched for several seconds. Then Martinez's voice came back, serious now. "Talk to me." For the next hour, Maria poured out her frustrations, her fears, and her growing certainty that she didn't belong in the academic medical world. Martinez listened without judgment, occasionally asking questions, but mostly just letting her talk. "You know what your problem is?" he said finally. "That I'm not smart enough for this? No, you idiot. Your problem is that you're trying to be something you're not. You're not a medical student who learned to be a soldier. You're a soldier who learned to be a surgeon. There's a difference. I don't understand. Santos, you didn't save Jackson by memorizing textbooks. You saved him by thinking like a soldier under fire, using every resource available and refusing to accept defeat. That's not academic medicine. That's combat medicine. And it's exactly what the Army needs." The conversation continued for another 30 minutes, with Martinez reminding Maria of every life she'd saved, every impossible situation she'd overcome, every time she'd proven that determination could overcome any obstacle. When she hung up, Maria felt something shift inside her. She was approaching the program all wrong, trying to fit into their mold instead of bringing her own strengths to bear. The next morning, she walked into Dr. Brennan's surgical rotation with a different attitude. Instead of quietly accepting his condescension, she began asking pointed questions about how the procedures they were learning would work in combat conditions. "Dr. Brennan," she interrupted during a lecture on abdominal surgery, "what modifications would you make to this technique if you were operating in a field hospital without proper lighting or stable power?" Brennan looked annoyed. "That's not relevant to proper surgical technique. It's relevant to the soldiers who need surgery in those conditions," Maria replied calmly. "If we can't adapt these procedures for combat environments, they're not useful for military medicine. Santos, you're here to learn established medical procedures, not to reinvent surgery based on your limited field experience." "My limited field experience includes performing successful surgery on 17 combat casualties with 0 fatalities," Maria said, her voice carrying the authority she'd learned under fire. "Maybe there's something to be learned from that." The room fell silent. For the first time since she'd arrived at Walter Reed, Maria saw uncertainty in Dr. Brennan's eyes. Over the following weeks, Maria stopped trying to be the perfect medical student and started being herself a combat-proven medic with unique insights into battlefield medicine. She couldn't compete with her classmates on biochemistry, but she could teach them things about trauma surgery that no textbook covered. When a visiting lecturer discussed emergency procedures, Maria raised her hand to describe how she'd adapted those procedures for use in combat zones. When residents debated surgical approaches, she offered perspectives based on actual battlefield experience. Slowly, attitudes began to change. Other students started asking her questions about field medicine. Residents sought her input on trauma cases. Even some of the attending physicians began treating her as a colleague rather than an interloper. Dr. Chen noticed the transformation during their next progress review. Dr. Brennan's most recent evaluation is quite different from his earlier reports, she said with a slight smile. He notes that you've become an asset to the surgical team, bringing unique perspectives that enhance the learning environment for everyone. I stopped trying to be someone I'm not, Maria explained. I can't out-memorize people who've been studying medicine since undergraduate school, but I can contribute knowledge and experience they don't have. And your academic performance? Still challenging, but improving. More importantly, I'm learning things that will actually help me save lives in combat. 6 months later, Maria stood in the same surgical preparation area where Dr. Brennan had first dismissed her as unqualified. But now she wore the uniform of a newly commissioned warrant officer, with orders to return to Afghanistan as the first advanced combat medical specialist in Army history. Dr. Brennan approached her as she prepared to leave. Santos, he said, extending his hand, I owe you an apology. When you arrived, I saw you as a threat to established medical standards. I was wrong. You were protecting the integrity of medical training, Maria replied, shaking his hand. I understand that. What you did here was more than just completing a training program. You proved that excellence comes in many forms, and that the military needs people who can think beyond conventional boundaries. As Maria boarded the transport that would take her back to the combat zone, she reflected on the journey from being just a medic to becoming something entirely new. She'd learned that earning respect wasn't about conforming to others' expectations. It was about bringing your own unique strengths to serve a larger purpose. 3 weeks later, Staff Sergeant Jennifer Hayes was treating casualties in a forward aid station when she received a call on the medical net. This is Warrant Officer Santos, came the familiar voice. I'm inbound to your location with a full surgical team. What's your status? Hayes smiled as she looked around at the wounded soldiers filling her aid station. For the first time in her 8 years as a medic, she had backup that could handle anything. Santos, we've got multiple critical casualties requiring immediate surgery. How's your equipment? Fully equipped and ready to operate. ETA 5 minutes. As the helicopter carrying Maria and her team approached the landing zone, Hayes reflected on how much had changed. The Army finally had medics with the training and authority to provide advanced surgical care in combat zones. Soldiers would live who might otherwise have died. And it all started with one medic who refused to accept the limitations others placed on her. Maria Santos had proven that there was no such thing as just a medic, only medics who were willing to be extraordinary. And there we have it, the complete journey of Maria Santos, from being dismissed as just a medic to becoming the first advanced combat medical specialist in Army history. Her story is one of determination, courage, and the refusal to accept limitations placed by others. What an incredible journey we've shared together. This epic tale clocked in at nearly 50,000 words. That's a full-length novella brought to life through storytelling. Creating content of this scope requires extensive research, careful character development, intricate plotting, and hours of writing and narration to bring you the most immersive experience possible. If this story captured your imagination, kept you on the edge of your seat, and took you on an emotional journey alongside Maria, I hope you'll show your support. Please hit that like button. It tells me you want more epic stories like this one. Subscribe to the channel and ring the notification bell so you never miss our latest adventures. These detailed novel-length stories take tremendous time and effort to create, and your support makes it all possible. Share this story with friends, family members, or anyone who appreciates great storytelling. Whether they're military veterans who understand Maria's struggles, medical professionals who can relate to her dedication, or anyone who's ever been underestimated and had to prove their worth, this story has something for everyone. Your engagement, likes, subscriptions, shares, and comments directly enables us to continue creating these immersive, movie-length stories that transport you to different worlds and introduce you to unforgettable characters. Thank you for joining me on this remarkable journey. Until next time, keep believing in the power of determination. And remember, you're never just anything when you refuse to accept limitations on your potential.